All right, so this is my uncle, and he lives in Murfreesboro, Tennessee, and his name is Eddie Kitzler, and we're going to be doing an interview about polio and post-polio syndrome. So my very first question is, what age did you acquire polio?
I think I was 5 years old. So that was about, 55, 56 years ago.
So 56 years ago, okay. Were you immunized as a child?
No.
So,
Not until afterwards.
So even though you had gotten polio, you still got the immunization afterwards?
Yes.
Okay.
Yeah.
Okay. And then what type of polio, post-polio, is associated with the symptoms that you currently have?
Yeah, I'm not sure I have no idea, but it's mostly just affected from my leg muscles.
Okay.
Is the only part actually that it has affected, but I'm not sure what name that they may have given it.
Yeah. So the two types are paralytic and non-paralytic. So if I had to guess, only because I've known you, I would say you probably suffer from paralytic because, obviously there's some distinct problems walking and things like that. Would you say that to be true? Yeah. Okay.
Yeah.
How would you say polio has affected your life?
Oh, as I get older, it's slowing me down. But, different things. When I was younger, of course, I couldn't do. But as far as how has it affected me, I don't dwell on it. I know that, I just do whatever I can, and whatever I can't, then I just move on to, I don't know, I just never really think about it.
Yeah, I've never known it to slow you down at all.
No. I probably should have slowed down when I was younger. And
yeah.
I'd be better now.
Is it painful?
No, I don't. I don't have any extra pain other than just the regular, probably normal aches and pains every now and then. But as far as daily things hurting that you could contribute to polio, no, I don't have, and I don't take any special medications or anything like that. So no, it doesn't hurt, no.
So what kind of career did you have, like when you started working?
Oh, I've worked in a machine shop. I've been a manager of a bakery, in a grocery store. I've worked in a restaurant. I've been a mechanic. I've been in sales and servicing fire extinguishers. Whatever I could find to do, I did.
So nothing. There was no hindrance to any job that you ever had.
Not to any that I ever had. No, right.
Okay.
I mean, there was just some that I couldn't climb be an electrician or climb a electric pole.
Yeah, you wouldn't be able to gaff up a pole. Yeah, that makes sense.
Right.
Yeah.
So I just had to know what I could do, and then if I needed a job, go for that type of a job.
Yeah. So what would you say is the most difficult symptom now, because post-polio syndrome happens many, many years after you've actually had the virus. So what would you say currently is the hardest symptom that you're having as you get older?
I would say it's walking and getting tired quicker. I can't walk as far as I used to.
Yeah.
I say and exercising, because then my muscles then start aching like the next day. So I'd say the biggest thing is just walking, and as far as I can walk before I have to sit down and rest. that's to me, that's the biggest thing. I can't walk as far as I used to be able to walk without getting tired.
Yeah. So as you get older, are you noticing that the fatigue is the only thing that is really increasing? So you're not losing any muscle, like you're not getting any troubles with like atrophy of your muscles or anything like that? It's just more tiredness? Like do you suffer from muscle spasms and things like that?
No, other than cramps,
Yeah.
but that's just, lack of water or whatever, being not being hydrated. But yeah, mostly that, and then of course to combat the tiredness, we got that three-wheeled scooter so that I can, go out with the family now
Yeah.
and go different places.
Yeah.
We just to I guess say to try to do things differently, by getting that scooter. I'm not homebound.
Yes. So that's helped.
Yes. Oh yeah.
Did
yeah.
you have to do any therapy or anything throughout this whole process? I mean, did you have to do anything special?
Oh, just over when I was first diagnosed with polio, I would go over to Finley at the hospital, and I'd have to set in a whirlpool, and then they'd put hot pads on my legs and stuff, and do therapy. But that's the only thing that I've ever done. That was when I was first diagnosed with polio, and I can't think really of any. I don't do any physical therapy now on a regular basis to for it. But I've had braces and I've had crutches, but I just threw all those things away because I was able to walk on my own. And after having 9 brothers and sisters and then 10 cousins living beside us, it was like, well, if I wanted to keep up with them, I just had to learn how to get around and walk.
So are you the only one in your family?
Yes, yeah. I got a sister and a brother younger than me, but I'm the only one that got polio.
Wow.
But I think at that time that I got polio, there was, I think, 4 or 5 of us in Cary that had got polio.
Like in your school?
No, not necessarily in school.
Oh, just in
No,
the town.
Right. I did go with, in fact, when I was going to school, there was 2 other ones. One went to the same grade as me, and then there was a guy that was, I don't know, maybe 2 years ahead of me that got polio.
So, I mean, if you can remember, can you even remember what happened? Like how you contracted it? Because it sounds like it's very contagious.
No, I can't remember. I guess I've probably heard stories about it, but that they did a spinal tap, and then that's how they found out that I had polio. But that's about it. That's the only thing I can ever remember Mom telling me.
Yeah, otherwise you're just a normal kid playing with your friends, right?
Right, yeah.
Yeah. Do you think there's anything else that's important to know? I mean, obviously polio has been eradicated in the United States since 1988. We haven't had a true polio virus outbreak for, I mean, literally almost 30 years. So would you say that that's, contributory to immunizations, or, I mean, what's your opinion?
Oh, yeah. I mean, that's great. And I forget if it's the Exchange Club or the Rotary Club. They're in the third world countries trying to immunize the kids there to try to get rid of polio in different countries, which is really great. that if they could get rid of it, over there also, because there was a lady here in Tennessee, I don't know, it was about 5 or 6 years ago. She was still in an iron lung.
Wow.
When she passed away. And there's a group here in Middle Tennessee. It's called Polio Heroes of Tennessee. And it's just, once a month they have a meeting, just the people that have had polio. And of course, everybody's getting older, just to talk about where we might be able to find doctors and stuff like that. Because right now it's hard to even find a doctor that has any idea about polio. Because they're, much younger. The doctors are much younger now. Like, what is that? And of course, then they don't know how to treat you. Then they say, just if you ever go into surgery, or make sure you let them know so that they don't give you too much anesthesia, because your muscles might not be able to, just using that anesthesia, I guess, could kill you, because your muscles are weaker and you wouldn't be able to breathe.
That makes sense.
So just a lot of different things like that we just have to make sure that a doctor knows. And I went through therapy a couple of years ago on a shoulder, and I told the therapist, and here in Nashville, there's a group of therapists or that are learning to be therapists, and then they ask the people that are in that Polio Heroes thing to come down, and they pretty much train on us, and that way they know that if you tell them that you have polio after they graduate, they know that they can't bend your legs or whatever like they can on a person that hasn't had polio. Because, it wouldn't take much to break a bone or something like that on a person that has polio.
Do you feel
and we don't bend like people, other people do.
Do you think it's difficult finding healthcare people?
It's not difficult. You can go to a doctor any place, but if you go and try to find one that has the knowledge, yes.
Yeah.
In fact, I went to one guy, and it was his father, actually, that used to treat people with polio, but he's passed on.
Oh.
And they sent me to his son, thinking that he might, have more of an idea than just a regular doctor. But he didn't. But, he said, yeah, my dad used to treat polio people all the time, people with polio all the time.
Yeah.
But, But no, I've never had any problems with doctors and nurses. Just tell them that I had polio, or I guess I don't say that I've had polio. I have polio, and so just. And as far as medication, also, I don't really have any problems with medication, taking hydrocodone or anything like that, and I don't hardly ever take any of that. And that's, if I have any pain, a couple aspirin is all I take, and it goes away.
So any other problems that you have are totally not related to polio. So like I'm just saying, like if you have high blood pressure or something like that, it's totally unrelated.
I would say so, yes.
Okay.
Yeah, because there's very few things that I could attribute to polio, as far as the aches and pains.
Do you think that having polio makes it more difficult for any other issues, medical issues that you might have? Like having surgery on your shoulder. I mean, that had to have been a little bit more complicated.
Well, they didn't do surgery. What they did, they just found out that I had heard it, and then I wasn't using it, and then it froze up.
Gotcha.
That's what they called it. They called it a frozen shoulder. And then I just went and started doing exercises and therapy, and the pain went away. So thank goodness they didn't have to do whatever that surgery is called on you. But no, I thought that's what they was going to, but they didn't have to do that. And that's probably been, I don't know, 3 years ago.
Nice. So really, polio hasn't done anything to you but make you walk funny.
I would say that's pretty much. I try as much as I can, go swimming, and if I go into a lake swimming or the ocean, then I know I need to wear a life jacket, but I still get in water, So I know I try to do things, and then if I see I can't, then I just back up and do something else.
Yeah, I've never known you to slow down. Obviously you're part of our family, and seeing pictures of, you and Jameson and Kristen, and you're doing all these things and going on family vacations, and you don't skip a beat.
Yeah, we try not to. I try not to hold the rest of the family back. It's what, because we're a family, and so it's just the way we are, and that's just going to try to keep on going on. I'll be 61 in January, so it's not. I'm not bedridden or anything.
Yeah, for sure.
Thank goodness.
Right, and then you still come to Ohio to visit us, so.
Yeah.
Well, I don't really have any other questions, but is there anything else that you think is important that you think would be good for other people to know, or?
Anything you can think of? Phyllis is sitting here, so I was asking her if she thought there was anything.
Nothing's coming along.
No, I really, just that if there's, just the people in the medical field, that if somebody says that they have polio, to just to, I guess, research it if they don't know anything about it, because it's been so long ago, and to listen to the patient about it, because like the one doctor said, well, you know your body, and you know what you've been doing for all these years and how you've been taking care of it. But that, I really, like I say, I don't dwell on anything, and it's so, I myself, I don't really think about it that often.
So probably when I asked you, you're like, what? I don't have polio. What are you talking about?
No, I'm glad to do the interview, so, let other people possibly know about polio and post-polio, because the post-polio is what's affecting all of us now, I guess you'd say, because it's all the muscles that we used to move and stuff. Now we've kind of wore them out.
Yeah.
So now it's coming, it's not as though it's coming back, but our muscles are getting weaker, and we're not able to do what we were, say, 10 or 15 years ago, because we're just wearing our muscles out.
And some of the polio survivors that didn't get it as severe as you are having a really hard time, because they haven't really had to deal with the symptoms that you've already grown up with. And so it's more difficult for them because they don't understand, what you've basically been fighting your whole life. And so some of them are even being misdiagnosed because, they're having post-polio syndrome symptoms, but they're being misdiagnosed because they either didn't have, full-fledged polio as a child, or they just had a fever and that was it, and they didn't really have any other problems.
Yeah, because it was so, it could just be a real weak strain of it, and it, went from one extreme to the other, the way it affected people. Yeah, that one girl that went to school with me, she just had a brace on up to her knee, and that was the only thing that had affected her from her knee down to her foot, I think is what it was. So you really didn't, you probably would have thought she had a broken leg or something.
Until you all get older, and then you're going to still have the same symptoms, and so that's where it really gets to be a problem. You know, not to you know, say that polio is not a serious condition, but really it's when you get older when it really starts to take its effect on you.
Yes. Yeah. I mean, that's I didn't even realize that it was that they had, you know, the post polio until this group, you know, one of their newsletters had started talking about it. So we're watching it so that I don't overdo myself, you know, and won't be tired all the time. So
well, I think you'd be a perfect poster child for post polio syndrome.
Oh, yeah. But all those people that are in this group, you know, if any of them need to contact me, or, you know, you want to contact me again for any more questions, you know, I don't have any problems talking to anybody about it, because, you know, as I'm walking, people say, well, you know, did you get hurt in the war? Or, you know, what's wrong with you?
Oh, I didn't even think about that. You couldn't even be enlisted.
Right. No, I signed up. You know, I had to sign up for military draft when I got 18, but, you know, I got the whatever it was.
Thanks, but no thanks.
Yeah, that's what they said. I've ridden bicycles and all that stuff, so I still have good balance and things. So
yeah.